project is on the growing epidemic of obesity and diabetes and the association between the two. My name is Gianna Denuzzo, and I did this project along with Grant Littman, Chi-Feng Yang, Teresa Quintero, and Mai Yervang. Not only does someone's body weight influence their personal image or self-esteem, but also body weight greatly has to do with the health and the internal effects it has on the body. Body mass index is a useful tool that helps figure out where a person is within the range of certain weights. Some people may be underweight at a healthy weight or may be classified as overweight. There are also an increasing number of people that are categorized as being obese, which is defined as having an even higher BMI than an overweight index. Although health problems can occur at any weight, there are higher risks when a person is obese. There is undoubtedly an increased risk of medical disorders and healthful consequences associated with obesity. Once calculated, a BMI can tell someone the type of body he or she has and which range they are in. A BMI that is lower than 25 is not as much of a risk as a person with a BMI greater than 25 to 30. A BMI over 25 indicates that a person has excess body fat on them, and therefore the body has to work harder to do its job in maintaining body levels and homeostasis. Because the body has to work harder and push its organs to the limit, complications tend to erupt. Diabetes is one of the diseases that can take place from the body being at an unhealthy weight range. In this project, we chose to focus on that association and gain further knowledge on the subject through charts, graphs, surveys, and studies. Recently, the prevalence of obesity has been rising due to less physical activity and other lifestyle changes. Along with that is the increase of diagnosis of type 2 diabetes. There is a strong correlation between the two health factors that go hand in hand with one another. The significant and constant incline of people's weight correlates with the incline of diabetes. Type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas stops producing enough insulin. It seems that when overweight, the pancreas cannot keep up with the body to maintain a balance of glucose. This hypothesis makes sense as data expresses association between excess weight and the result of diabetes. Both conditions, which are related to each other as well as to heart disease, increased significantly in just 6 years, with the prevalence of diabetes alone jumping nearly 26% between 2001 and 2007. Clearly, the prevalence is significant and the correlation of what it relates to is worth identifying. A study was found from an internet database called PubMed that proved that obesity is a risk factor for diabetic nephropathy and retinopathy. The methods and results of this online case will be further described. Additional background information on the correlation of weight and diabetes was found from California Health Interview Services. The statistics from CHIS were based on age and diabetes and also body mass index and diabetes. The correlations and specifics of these studies will be elaborated on more thoroughly in this video.
My name is Grant Littman, and I will be talking about the materials and methods that were used in our article. The researchers decided to use people that lived in Japan that were currently admitted to one of two hospitals. They used data from Saisakai Central Hospital from January 1999 to December 2004, with a total of 1,834 patients. The other hospital was Keio University Hospital. They used a total of 1,093 patients from April 1998 to September 2010. These subjects had to have had type 2 diabetes with an estimated glomerular filtration rate of 30 milliliters per minute per 1.73 meters squared. Before the researchers started the research, they made sure the ethics committee of both the hospitals approved of the protocol. They also excluded any subjects whose etiology was strongly suspected to be renal disease. The researchers currently defined current obesity as BMI on hospitalization of 25 or more, previous obesity as BMI on hospitalization of less than 25, and self-reported maximum BMI in the past of 25 or more, and continuously lean as maximum BMI of less than 25. This was something the researchers had to define in order to exclude and include certain subjects. Any person that was in the hospital that had in the past or at that time a BMI of 25 or more would be able to be part of the study. During the mission, there were high levels of HbA1c, which was determined by high-performance liquid chromatograph. This was recommended by the Japanese Diabetes Society and was converted to National Glycohemoglobin Standardization Program value. The equation that was used was milliliters per minute per 1.73 meters squared was calculated as 194 times CR minus 1.094 times H minus 0.287, with further multiplication by 0.734 for female subjects. Either before or during admission, every subject underwent a fundoscopic examination by a trained ophthalmologist. A fundoscopic examination is just a normal examination of the ability of a person or subject's sight. Subjects with the albumin excretion rate of 24 micrograms per minute or more in the 24-hour urine sample were considered to have diabetic neuropathy. Diabetic neuropathy are a family of nerve disorders caused by diabetes. This is a simple definition of what diabetic neuropathy is, and it is caused by many different types of symptoms. It can be caused by metabolic factors as well as neurovascular factors. These factors are usually found in people with diabetes for at least 25 years and are usually overweight. About 60 to 70% of people with diabetes have some form of neuropathy. The researchers were also looking to classify some subjects as diabetic retinopathy, which was based on the Davis classification. Diabetic eye disease refers to a group of eye problems that people with diabetes may face as a complication of diabetes. All can cause severe vision loss or even blindness. This shows the seriousness of which diabetic retinopathy can cause. Diabetic retinopathy is caused by people with type 2 diabetes as well as people with obesity. Researchers defined other things to help their research. Hypertension was defined as systolic blood pressure greater than 100 millimeters of mercury, diastolic blood pressure of greater than 90 millimeters of mercury, or the prescription of antihypertensive medication. Dyslipidemia was defined as LDL cholesterol greater than 3.63 millimoles per liter, triglyceride greater than 1.72 millimoles per liter, HDL cholesterol less than 1.04 millimoles per liter. These different symptoms are usually caused by obesity and are measures to use to see if subjects with these symptoms will fall in the parameters of the experiment. ANOVA and chi-squared tests were used to analyze the difference in baseline characteristics among these obese subject categories. The researchers also used the chi-squared test to evaluate the difference in prevalence to compare it with the bona fides correction, then compared it multiple times. The probability equivalent, which is usually p equals 0.05, was actually p equals 0.017. They adopted covariates factors such as sex, age, disease duration, hypertension, dyslipidemia, HbA1c, and obese status, currently obese, past obese, and continuously lean in this study. They found that p less than 0.05 was considered as statistically significant when looking at the different levels. To perform all the analysis, they used IDM SPSS software version 18.
Hi, my name is Mai Yer, and I will be reviewing the results. As a result of the methods and materials used for this case study, the researchers analyzed a total of 2,927 people. Out of the 2,927 people, 2,038 of them were male and 889 of them were females. With these numbers, the patients were separated into three groups: the continuously lean group, the previously obese group, and the current obese group. Doing so, the researchers compared the three groups to their risk factors of other diabetic disease. The prevalence of the current obesity in the total subject was 33.6%, previous obesity 41.5%, and a continuously lean state 24.8%. The prevalence of neuropathy was significantly different among the categories in both current obese, which was 40.6%, and previously obese, which was 35.6%, which had a significantly higher prevalence of diabetic neuropathy than in continuously lean patient, which was 24.3%. The researchers then decided to divide the patients into quartiles according to their current BMI and found out that as the BMI increased, so did the prevalence of neuropathy. Using the logistic regression analysis, both current obesity and previous obesity revealed a significant odds ratio for neuropathy, as well as diabetic retinopathy, independent of sex, age, disease, and duration, hypertension, dyslipidemia, and HbA1c. In which means that those who had been or are currently obese all had a higher chance of the diabetic diseases listed above. Those who have been obese or were obese in the past still had a higher chance of developing or acquiring a chronic diabetic disease compared to those who were always lean and never were obese.
My name is Chief Yang, and I'm doing the data set of our group presentation actually. First table which I found on Chiz's data set is going to be the first one here. In this table, there's going to be two factors that I compared. The first factor is going to be which either type 1, type 2 diabetes that they were found in, and the age in which they were first diagnosed with type 2 diabetes. Age range from 0 to 9, 10 to 19, 20 to 29, 30 to 39, 40 to 49, 50 to 59, 60 to 69, and 70 or older. Age 0 to 9, about 2.7% of the population have type 1 diabetes. From the column type 2 and other types, I can use it because there wasn't enough information presented in the GIST data set. From age 10 to 19, about 13.5% of the population have type 1 diabetes. 1.6% of the population have type 2 diabetes. 20 to 29 of the age group have type 1 diabetes, about 7.2%. 6.6% of the population has type 2 diabetes. From age 30 to 39, about 17.4% has type 1 diabetes. And then 14.1% from the 30 to 39 age group has type 2 diabetes. From age 40 to 49, about 19.9% have type 1 diabetes. Along with type 2 diabetes, which is going to be 25.1%. From age 50 to 59, 22.8% has type 1 diabetes. About 28% have type 2 diabetes. And then other types, they have 13.2%. From age 60 to 69, about 11.7% have type 1 diabetes. 16.6% has type 2 diabetes. And then age 70 or older, 4.8% has type 1 diabetes. And then 7.8% of the population have type 2 diabetes from age 70 or above. The second chart that I found on Chiz's data set was this one here. In this chart, I compared two factors which are body mass index of an adult and which type of diabetes that occurs in every BMI index. From this chart, I have four categories from body mass index, in which it has four categories. First category can be 0 to 18.49, which is considered underweight. 18.5 to 24.99 is considered normal weight. 25.0 and 29.99 is considered overweight. And then the BMI of 30 or higher is considered obese. From the BMI of 0 to 18.49 is considered underweight. There's no evidence that shows that this category has type 1 diabetes, but in type 2 diabetes it has about 0.5% of the population have type 2 diabetes. From the BMI of 18.5 to 24.99, which is considered normal weight, about 29.5% of the population have type 1 diabetes, 15.4% of the population have type 2 diabetes, and then 15.6% of the population have other types. From the body mass of 25 to 29.99 is considered overweight. 34.4% of the population have type 1 diabetes. 34.2% have type 2 diabetes. And 35.4% have other types. From the body mass of 30 or higher, which is considered obese, 36.1% of the population have type 1 diabetes. And then 49.9% of the population have type 2 diabetes. And from the other types, 44.5% have other types. in the last chart that I found on Tuesday, which is going to be the bottom one here, from age 20 to 29, 13.1% from the normal BMI range has diagnosed with diabetes, 37.2% from the BMI range from overweight has diagnosed with diabetes, and then 49.7% of the category from obese BMI has diagnosed with diabetes. And then from age 30 to 39, 14.5% from the normal BMI range were diagnosed with diabetes, along with 34.4% from the overweight have been diagnosed with diabetes. And then from the BMI from 30 or higher, which is considered obese, is considered from 49.5%. From age 40 to 49, about 14% of the population was diagnosed with diabetes from the normal BMI range. 29.9% was diagnosed with diabetes from the overweight range. And then 55.6% were diagnosed with diabetes from the 30 or higher from the BMI range. From age 50 to 59, about 15.9% of the population were first diagnosed with diabetes from the normal BMI range, and then 34% was diagnosed with diabetes from the overweight range from the BMI. And then from obese or higher, about 49.9% of the population were diagnosed with diabetes. From age 60 to 69, 16.7% of the population has first diagnosed with diabetes from the normal BMI category. 38.9% of the population has diagnosed with diabetes in the overweight range of the BMI. And the BMI of 30 or higher is considered obese, which is about 44% of the population which is diagnosed with diabetes. From age 70 or above, about 29.8% of the population been diagnosed with diabetes from the normal BMI range, and then 37.8% of the population have first diagnosed with diabetes in the overweight category. And then the BMI of 30 or higher is considered obese, which is 31.3% of the population which is diagnosed with diabetes. From the data that I found, if your BMI is 25 or higher, you have a likelihood of developing type 2 diabetes.
Our main article states that if you were previously obese or is currently obese, you have a higher chance of getting type 2 diabetes, along with the many complications that the disease brings. The CHIS data supports our main article by stating that if you have a BMI higher than 25, meaning that you are either overweight or obese, you will have a higher chance of getting type 2 diabetes. After analyzing the prevalence of neuropathy associated with body weight seen among Japanese subjects with type 2 diabetes, due to excessive past and present obesity, we can conclude that obesity is closely related to neuropathy and type 2 diabetes. Many can think that diabetes can only be developed from present and future obesity, but in most cases that is wrong, because diabetes can be developed from past obesity experiences. This now indicates the correlation of effect of obesity on neuropathy. When it comes to the investigation of obesity, there's a certain mechanism that can be used in order to determine how obesity in the past will have its consequences and complications associated with type 2 diabetes. When it came time to analyzing the correlation with current BMI and BMI coming from the past, these both were closely related to neuropathy. This is also a known fact that current BMI and BMI from the past are interconnected with one another. Only because if she or he had a high BMI in the past, it is likely that the BMI in the future is higher. When it came time to studying and analyzing the effects of previous obesity, we needed to separate the effects of current obesity with previous obesity. This all states that we can interpret the effects of previous obesity with diabetic neuropathy. It doesn't matter if neuropathy and type 2 diabetes actually arises from. Overall, diabetes has always been the main controversy among many humans. In other words, type 2 diabetes has always been so strictly associated with obesity and basal metabolic syndrome that it is hard to discriminate the causes associated with basal syndrome. After doing all the differentiating, it was possible to find out that obesity existed independently with the presence of diabetic neuropathy and is expected to be functional to all type 2 diabetic patients. Recent studies that have been correlated together and had advocated this concept relate obesity with neuropathy. There was also valid support that was found on CHIS, which helped this case study be more effective and maintained. The CHIS data stated that those who were overweight and had a BMI in the range of 25 through 29 had slightly higher chances of getting type 2 diabetes, and those in the obese range with a BMI of 30 or higher had a higher chance of getting type 2 diabetes. This all relates to the high consumption of fatty foods and sugary beverages that leads a person to gain weight and later on suffer the consequences of getting type 2 diabetes along with many other diseases. Once the person has diabetes, it will make it easier for the person to get any other health problems associated with neuropathy. Until this day, it is unclear on the concept of diabetic neuropathy and obesity-related neuropathy. And if a patient ever has both of these conditions, it will make it very hard in order to discover what the main cause is. In order for diabetes to influence the level of kidney function in the future, these two concepts are continuous and inseparable. With all this data put together, this study indicated that whether obesity started in the past or in the future, obesity is a factor that is linked to type 2 diabetes and diabetic neuropathy.
Does someone's body weight? It's gonna take a while. Okay. I know it is. Okay, let me take a swim. Stop looking at me! You're going to do like 2 hours of laughing. Index is a useful tool that helps figure out the methods and results. The methods and results. The methods and results of this online case will be further. I know, stop saying that. The methods and stop, turn around. Hug your ears. The methods and they use data from, okay, yeah, I need to learn how to say these. Psychia? Where? They also excluded any subjects who They also excluded any subjects whose etiology was strongly suspected to be either before or during admission. Every subject underwent a fundoscopic examination by trained admission. Every subject underwent a fundoscopic examination by trained either before or during admission. Every subject. I'm so worried about saying it. I'm gonna say it again. Systolic blood pressure greater than 140. What's mmHg? Of mercury, right? Okay. Hi, my name is Maya, and I'll be reviewing the results. Start over. Okay, why don't I just start the whole thing over? The prevalence of the current obesity in the total subjects was 30, damn it! Okay. Meaning those who, this is harder than it looks, seriously. Patient into quartile. Dyslipidemia. Hypertension, dyslipidemia. There you go. Dyslipidemia, okay.
36.1% of the population have type 1 diabetes, and then 49.9% of the population have type 2 diabetes.